Hi friends, welcome to another SMNP Reviews YouTube video. I am Kennedy Goode, one of the facilitators on the SMNP team, and I wanted to touch on a subject that is commonly asked about in our new NP group, and that's working full-time as a remote telemedicine nurse practitioner. After the COVID-19 pandemic, this position has become more and more popular and has definitely increased healthcare access to those in rural areas and vulnerable populations. So what does telemedicine look like for me? What does my day-to-day look like? The flexibility is definitely a perk of the job. I work a typical Monday through Friday, 8 to 5 p.m. schedule and see on average about 14 to 16 patients a day. I have an in-home provider who sees the patients in their home on a routine basis, and then I follow up via telehealth. The nice thing about this is not having that morning commute. So I can wake up an hour before and get some errands done or catch up on work, which typically was that commute time. Or I can wake up about 15 minutes before, get ready, open my computer, and start my day. I'm also able to get things done around the house on my lunch break or run to the grocery store if needed. So once I start my day, I review my patients, prep my patient charts, check in with my MA, who also works remotely, which is pretty cool, and plan out my whole day. I try to get my acute visits in the morning, just in case they need an antibiotic, maybe labs, imaging, or even a referral, and I see them as soon as possible. Then I move on to my follow-ups. I work primary care, so I see a lot of diabetes, congestive heart failure, COPD, all of those fun things. Another wonderful thing that I enjoy is the autonomy of the job. I can freely make decisions, which can be scary at times, but is what I was looking for when I became a nurse practitioner. I really have to use my critical thinking with every patient and ask myself, is this something that needs to be seen in person or can I manage this via telehealth? Which leads us to our next discussion. So we can't talk about all the good things without talking about the challenges. And when it comes to autonomy, I encourage nurse practitioners who want to do telemedicine to practice for 1 year in a clinical type setting before going fully remote. I believe it's so important to have that hands-on experience before not being able to physically assess or even sometimes see your patients. Another con of this position, or I should say challenge, is not having that social interaction. I sometimes miss having coworkers to talk to throughout the day, bounce ideas off of, or just catch up on other things. Now it's just me and my honorary NP pups. I will say my job has done a great job of creating a virtual workspace where I have many nurse practitioners, doctors, PAs I work with that I can call on at any time to talk through things with. So I'm not totally alone to fend for myself. I have tons of resources available. Another challenge is technology. We love technology, we hate technology. We're using technology now for this video. 90% of my patients are Medicare, so sometimes technology does not always work in our favor. It's important to know the laws and limitations within your state of practice around telemedicine before seeing patients and billing for these visits. And this creates our discussion of legalities. So as we discussed just a few moments ago, it's so important to know billing laws. When it comes to telemedicine, here are some questions to ask and look up. Who can be seen via telehealth? Is video for telemedicine a requirement? Can it be a telephone call only? Does length of appointment matter? These are all so important to know, especially when you run into those technological challenges. Another legality that is important to review is prescribing. Some states prohibit prescribing substances via telemedicine if the provider has never seen the patient in person before, even if they're not controlled substances. You also want to know what defines a patient-provider relationship in your state. Knowing these rules is so important in being a productive and proactive nurse practitioner. We want to provide the best care to our patients, but also to be sure to be following all of the rules when doing so. And so now let's talk about job options. We get asked a lot, how can I work remotely? Utilizing outlets like Indeed, LinkedIn, or reaching out to local recruiters is important. Tell them exactly what you're looking for. I actually applied for a job that was in-person home visits. I told them what I was looking for, and they came back and offered me a telemedicine job as it aligned well with their company and what I needed. That's why it's so important to be honest in your interviews, as you never know where that can lead you. And finally, if you do decide to take on a full-time remote job, I always encourage people to work a side hustle to keep up your skills. It's not 100% necessary, but could be good for the future. I work in both aesthetics and hospice as needed, and both keep me seeing and interacting with patients, assessing and performing skills such as IVs and injections. Even if it's just a few days a month, it's important and will be helpful if you decide to move away from the remote world in the future. So overall, working remotely has been great for me and my family, and I hope this video helps give you some insight and can guide you to the best decision when choosing your future endeavors. Thanks for joining.